it's Crystal Gornto, founder of HeartStories, and we are here with another episode of Ask the Expert with Dr. Jay Woody, the Chief Medical Officer and founder of Legacy ER. Welcome, Jay.
Thanks for having me again.
Sure. So glad to have you. There's always so many things to talk about. We have our huge list, so let's knock them out. So we are here in Texas. We just are seeing the snow melt, getting through the Snowmageddon or Snowvid 21. So tell us, I know that has affected everyone, including medical facilities. Tell us how that went for Legacy ER.
Absolutely. So I'm sure all of us have a personal story about what the weather and the impact that it's had on all of us here in the last few days. A lot of hardships for a lot of people. So heart goes out to them. The one thing that I'm proud of is that despite all of the power outages and snow and ice and whatnot, that Legacy ER and urgent care was able to remain open. In fact, our urgent care was the only urgent care in Frisco that continued to be open and treating patients despite all of this adversity. One of the reasons is because we have external power generators. So even when the power went out, we were able to keep the lights on. We also, just the dedication of our employees, we had employees that actually spent the night at our facilities.
Wow.
So that they could be there the next day. We put people up in hotels, close by, so they didn't have to drive home and drive back. So we're really dedicated to taking care of the people of Frisco. And you know what? Despite the weather, they were still coming in.
Okay, yes.
So then we were happy to take care of them and glad that we were able to be there.
I didn't tell you, but I was driving up Legacy one night. Oakley was begging me to try to go get food, and I have a 4-wheel drive, and there was nothing open. But we were driving up, and we were passing your Legacy and Main location, and the lights. I mean, it was pitch black. There were no lights except yours. We could see that your lights were on. And then while we were driving by, all the lights came on, like it was the rolling blackouts,
Right.
But I could see that your lights stayed on. So that's amazing. You must have some serious generators to make all of your equipment work.
We do. And it kept us warm too, which is important because It's hard to take care of people when you're cold. I know a lot of people know what that's like after having their power go out at home.
Oh man, it's been nuts. Absolutely nuts. Texas was not built for this. That's another story for another day, though. We won't go there. Lots of politics happening behind the scenes around that.
That's right.
But as you know, with all of that has taken a front seat in the news and on social media as Snowvid, Snowmageddon. But COVID is still here. So tell us, like, one of the things that my personal experience is that I got COVID. Obviously, I don't know if you know my story. I lost my father in December to COVID, and
sorry about that.
Thank you. Yes, I know you know. And I personally got COVID during like 3 weeks ago, got really sick, ended up with myself in the hospital with some weird complications. So it's serious, and it's here. It was here until Snowmageddon or Snowvid. But what I found for me is that we were all out sledding outside when we had no power, and then the neighbors all came in to warm up. And at first we were kind of like awkward. We hadn't seen each other in a house in so long. And then we were like, wait, we've all had COVID. They all got it together at Christmas. And then I just recently got it for my kids. So what's the deal with that? Are we safe to gather if we know everybody in the gathering has had COVID recently, and how recently is recent? And what's your expert medical advice on the antibodies, I guess?
Sure. Great question. And I think, you make a good point is that despite, us all being distracted with frozen pipes and the snow and whatnot, that, COVID unfortunately did not go away. COVID is still here, definitely making progress with the number of cases being down. But, our goal is to continue to be vigilant and not sort of let this just be a blip and, us be squirrels and get distracted and chase another nut. So COVID is still here. People are still getting COVID. Some people are still getting very, very ill. And again, you personally know what,
Yes.
COVID, the travesty it can have on a person and a family. So, continue to be vigilant, do all the things that we know that we're supposed to do. The mask wearing is definitely working. That's, the reason the numbers are down is not because of vaccinations. It will be soon, but it's because people are doing the, good things to help each other. So that being said, to get to the point of, hey, I want to hang out with my friends that I know were COVID positive. And I say this with a little lack of full clarity, but I think if everyone's certain that they did have COVID, that within a 3 month period, and I say 3 month period because that's when currently they believe the antibodies are strong and reactive and working well. Could be longer, but currently that's the belief. So I would say get together, but I would still be vigilant. I would still practice social distancing. I think a lot of us will let our guard down, and that's
Yes.
where you could run into trouble, because there could be one person in your group of friends that, yes, they had COVID, very, very mild case, which means their antibodies dry up or go away
Mhm.
faster, and then they could get,
Oh,
reinfected. So I think it is, fine to do some of the things that you talked about, but I wouldn't, wouldn't sort of just huddle together
free
with,
for all.
10,
Yeah.
10 of your closest friends. But I do think that it would be, it wouldn't be taking high risk to do something that you just described, and that goes too for those that have been vaccinated and are at least 10 days out from their second vaccine. They kind of
10
fall
days.
into that
Okay.
same category of people that are, are partially sort of can fight off the disease. Now, that being said, I've had both my vaccines. I'm vaccine safe. It's good. I definitely was in that 1A group because I'm a frontline healthcare provider,
Right.
and that being said, I still, when I work, I wear my shield, my mask, my N95 mask, my gloves, my gown. I do, nothing has changed for me because I've been vaccinated, nor has it changed for our employees. We continue to do all the sort of cleaning, using our UV radiation to kill COVID. We, despite being vaccinated or having been infected, we continue to operate just as if we don't have any immunity. And I think that sort of that should be the attitude of everyone. Find to
Mm,
do a few other things, but just don't go wheels off and say, hey, COVID's over, and let's just
right.
pretend, put the blinders on and pretend that we're all going to be all good. I think we'll all be good if we remain vigilant. So sorry,
Yeah.
that was a long-winded answer to the
No,
question.
that's great. That's actually the answer. That's so about the vaccine. Do you think that or not do you, what is the, do we have evidence, research, that data that tells us how long the vaccine, is it like the flu shot? You'll get it seasonally? Like how long will it help us?
Well, you're asking the $1 million questions, and so I think this is there's a question mark there because it's just too early to know,
Hmm.
because we kind of need to check a year out from now to see that were vaccinated. Do they still have antibodies? The problem that we're running into, and the reason that we still all need to be super aggressive at stopping COVID as quickly as possible, is something you might have heard of, the mutant strains of COVID.
Right.
And the problem with influenza and why you have to get a new vaccine every year is because it's essentially mutant strains of influenza, and so last year's vaccine isn't effective for this year's vaccine because it's mutated. So
Right.
the best thing that we could do as a community and as a country and as the sort of globally is stop COVID in its tracks, because the longer it sticks around, the more mutations that happen, which means the longer it's going to be around because the vaccines won't eventually be effective against it. So
Right.
stopping it as quickly as possible is really should be job number one, so that we don't have to get a COVID vaccine every year. Cause I get my flu shot every year, but I don't enjoy it. And my kids don't enjoy it. So I would love to
Right.
not have another vaccine that I have to get every year if possible.
Right. Oh my goodness, I didn't even think about that. But oh, makes sense. So tell me about, we're okay. I guess I have one question, one more question. Have we seen any numbers? Does it feel like the snowmageddon, everybody being stuck in their houses, helped us at all? Did it help us, like when we were in quarantine and we were saying flatten the curve? This was sort of like a self quarantining snow.
You know
Um,
what? I'm just speaking for myself, but I have already thought about that this might, despite the hardship that it's caused with the power and pipe, plumbing and things like that, this actually for our community probably was the best thing that could have happened as far as
yeah.
COVID goes, because we were forced to quarantine even if
Yeah.
we didn't want to, and so I suspect that we will definitely see a drop in all those communities that sort of were forced to stay at home. There's no doubt, because we know that it is effective. We've just never sort of been unified enough to have everybody on board with that. And this
Yeah.
sort of the snow and ice made us do it. So it'll be interesting to see sort of the number of cases over the next 2 to 3 weeks. I think will let us give us a picture of what happened by us all
Yeah.
staying home.
That'll be great if we get some sort of a gift out of it. I mean,
Yeah, we got to get something right.
yes, yes. Okay, so finally, tell us about home remedies. We find out we're COVID positive, we're not severe enough to go, critical enough to go to the hospital. What are the best things that we can do at home?
Sure. So, I mean, I think with the COVID is, if you're breathing okay, you're not having any like sort of major issues and all, you don't necessarily need to, come into like CR. Um, Obviously, if you're short of breath or you're concerned or you're getting dehydrated, anything like that, obviously, I would highly recommend that let someone evaluate you just to make sure that you're okay. The recommendations that we typically have for patients that are positive, outside of sort of certain prescriptions and things, that there's caveats to those, because I know there's been a lot in the press about steroids and zithromax and things like that, and there are cases where those are the right things to do, and then there's times when they aren't necessarily the right things to do. But the things that I always recommend for my patients, as long as they don't have a contraindication to them, is that there's been some data that says that a few things are helpful, and that those are vitamin C, vitamin D, zinc, melatonin,
Oh,
and yeah, melatonin is an interesting one. So take it at night. Maybe it helps you sleep, but it also there's been some studies that show that it interferes with the spike protein binding to cells. And again,
interesting.
this is not from the Lancet,
Right, right.
there. The good thing is most of those there are essentially harmless, so they're not going to
Right.
hurt you. In fact,
Yeah,
I take vitamin D pre-COVID just
right.
because
Same.
mine was low. So I was like, well, I'll just keep taking what I'm taking. And then last one that I actually think is probably the most effective, and this is again if you don't have any contraindication to taking it in, and that is aspirin. And the reason that aspirin is recommended is because COVID, we're finding is causing this inflammatory response. And in fact, that's the reason that people get into trouble with COVID is the
Right.
body's own inflammatory response. It's not actually the virus itself. It's just causing the immune system to attack so strongly that your lungs get overwhelmed with fluids from trying to fight the virus off.
Right.
But other things that we found is that people start to have increased levels of clotting,
Yeah.
again from that inflammation. And so obviously a DVT, or a deep venous thrombus, which typically is in your leg, very common occurrence of people sort of post COVID or in the middle of COVID getting those. And the reason those are dangerous is because they ultimately could lead to a pulmonary embolus, which is a blood clot that goes to your lungs. So
Right.
I recommend usually people that are COVID positive, again, if it's safe for them to take aspirin, I recommend taking the 325 milligrams of aspirin for at least 2 to 3 weeks post being positive.
That's
Um,
good. Yeah.
so those are easy. You can pick those up at the the over the counter, and again, most of them have minimal side effects, and there's a potential that they could be helpful.
Tell me real quick. So I did all of those things except the melatonin. I didn't know about that one. But as far as vitamin C, what's your like? Can you tell us recommended dosage?
Yes, I can. And I'm just verifying. That's what I'm looking at. So 2,000 milligrams, 2 to 3 times a day.
Okay,
And I'll
2,000
just
2 to 3 times a day. That's a lot. Yeah.
Yeah, that is. And I'll just tell you, I'll run the list real fast. Vitamin D, 4,000 unit IUs a day,
Okay.
which is a lot. If you look at your little RDA, you're going to go, wow, he's crazy. So, but again,
Oh
this is,
yeah.
this is short, this is short term. I'm not recommending this for a long term, but, and then the melatonin is 10 milligrams before bed.
Okay.
And then the zinc is 100 milligrams a day.
How do you? Let me ask you this. That was the one that I had the hardest time finding. So I was just taking what is that stuff called? The zinc stuff, Zycam. The or
Zycam.
is Zycam the
It
like
ha-
melting?
yeah, it has zinc in there. I don't know how many milligrams.
I know. I looked it up and it's not as much as you would think. It's really hard to find too.
Well, and I think because of COVID, there's a lot of people buying these things up just because they're
Yeah.
sort of the secret formula got out.
Yes, yes, but it did. And I mean, as sick as I got, I'm grateful. I was taking all this stuff as soon as I got the positive
Yep.
test.
Yep. And actually prophylactically, you can take all these medicines at a much lower dose. There's some thought that that just sort of is helpful. Again, there's not any hard data about this, but there is some sort of subtle data that says it may be helpful. And so sort of my approach is it might be helpful, minimal, harmful effects or side effects. So none of those are going to hurt you. And some of those are probably deficient in vitamin. Most of us in North America are deficient in vitamin D to begin with.
Right. Yeah, no, that's good. And I even found like my little aspirin packet must have been like a 24, whatever it was. It was like, oh, that was the perfect. I bought, went and bought it at CVS and it was just the perfect amount. It lasted me right through. So,
Perfect.
well, thank you so much. I know that this is all incredibly helpful information, especially I think as we're in Texas dealing with all of this weather, and I know around the country also, it just gives us some information that we don't have to go search for. It's all right here. So
There you go.
thank you so much for that. And we will be back soon with more Ask the Expert updates from Jay Woody. And in the meantime, if they want to find you, it's legacyer.com.
That's right. And we're open, and don't slip and fall on the ice. We're seeing a lot of that. So put your mask on and put your boots, your good boots on. That's my recommendations.
Okay. All right. Thank you so much.
You're welcome. Thank you.